Next, we're honored to welcome this year's graduation celebration speaker, Mr. Rogelio Riojas. Mr. Riojas is a distinguished healthcare leader and social justice activist whom we are proud to call one of our own. He received a Master of Health Administration degree from the school in 1977 after earning undergraduate degrees in political science and economics from the University of Washington. He was a well-known leader among Latino student activists. In 1978, after graduating with his MHA, he founded SeaMar Community Health Centers and has been at the group's helm ever since. He developed SeaMar from a single medical clinic in Seattle to a comprehensive health and human services organization in 11 counties across the state. That has had a huge impact in providing access to care and other services for vulnerable populations, particularly farm worker communities. Mr. Riojas is an outstanding role model whose work has been transformative and inspiring and whose values align so perfectly with the schools. He serves on the University of Washington Board of Regents and was honored in 2012 with the University of Washington's prestigious Charles E. Odegaard Award for his work on behalf of diversity. In 2016, he received the School of Public Health's Distinguished Alumni Award, our highest honor. Please join me in welcoming Mr. Rogelio Riojas.
Thank you, Dean Godwin. Good morning, everyone. Thank you for inviting me to your graduation. I feel honored to be among students, graduates, family and friends, faculty, and administrators to celebrate the University of Washington School of Public Health 2019 celebration. I want to congratulate you for your excellent accomplishment. You are graduating from the University of Washington, one of the most prestigious universities in the world. The School of Public Health is one of the best in the world because of its students and its renowned teaching and research faculty. Its graduates include many distinguished alumni. I want to recognize a few of them to give you an idea of the brilliant individuals the School of Public Health attracts. Michael Gale, Jr., PhD, pathobiology, professor in the UW Department of Immunology. His work has led to advances in the development of drugs to cure the hepatitis C virus. Bruce M. Passetti, MD, PhD, MPH, professor of internal medicine and epidemiology. He has spent over 30 years working on a variety of research disciplines, including cardiovascular disease and large-scale genetic studies. Bernice Don, MD, MPH, Chief Medical Officer for Liberia. As Minister of Health, Dr. Don has worked to build a resilient healthcare system in Liberia. Patricia Garcia, MD, MPH, Dean of the School of Public Health at Universidad Peruano Cayetano in Lima, and Director of the Instituto Nacional de Salud in Peru. Dr. Garcia has worked on several studies involving the prevention of sexually transmitted disease, including a study to prevent transmission to newborn. These four School of Public Health alumni have made significant contributions to the field of public health in 3 different countries. It is needless to say, but it's important to note that there are thousands of UW School of Public Health alumni that are also doing their important work in public health in the community. These individuals show up every day to work to improve the lives of people in the world. I also want to recognize them for their countless contributions to our country. You are in great company as a new graduate of the School of Public Health, and I am certain you will continue with a great tradition of making a difference in the field of public health. You and your family should be very proud of your accomplishment. Let me tell you how I became a student at the University of Washington. I think stories like mine are important because they tell the story of how the University of Washington became the great, diverse institution it is today. Minorities have experienced discrimination since the beginning of our great country, putting them at a disadvantage in employment, education, and in achieving the American dream. Consequently, people of color had lower income, lower education, and lower wealth. For these reasons, in the 1960s, many states started affirmative action programs to mitigate the impact of institutional racism. Trying to correct a long historical problem of not accepting minority students, President Ortega started the Educational Opportunity Program in the late 1960s. In the 1960s in Washington State, the Latino community was comprised of families who worked mostly as farm workers. We did not have a professional community. Today, we still have farm workers working in the state, but Latinos also have a professional community because the University of Washington was willing to take a risk on a group of students like me. My family is originally from Edinburgh, Texas. We started migrating to the state of Washington in the early 1950s to work in the farms. Every year, we did farm work from March to November in Washington and California, and then returned to Texas in the winter. When I was 14 years old, my father decided to stay year-round in Othello, Washington, making it possible for me to graduate from high school and attend college. I arrived at the University of Washington in 1969. The university, like many universities in the United States, was experiencing severe student turmoil and unrest. The country was in the middle of the civil rights movement and the protests to stop the Vietnam War. As a young person coming from a rural area, these movements were new to me. I embraced both movements and I got involved in trying to make social justice change. I participated in peaceful marches to support civil rights and to stop the Vietnam War. As students, we peacefully took over university offices in attempts to increase minority students and faculty. We exercised our constitutional right of using civil disobedience to create change. We also got involved in community activities. For example, when the community attempted to shut down the construction site at the Seattle Central Community College because the construction industry would not hire minority workers. We made a significant difference in helping the university to accept diversity. I learned a lot by participating in these movements. It inspired me to get an education in health administration at the University of Washington and molded me to who I am today. As a proud graduate of the University of Washington, I hold undergraduate degrees in political science and economics and a master's degree in health administration from the School of Public Health. I decided to work at a community health center as a way to give back to my community. For the last 40 years, I have served as the executive director of SeaMar Community Health Center. SeaMar is a community-based organization dedicated to serving the most vulnerable members of our community. The mission of the organization stresses advocacy that reduces health and social disparities. Raising our voices to legislators and policymakers has made SeaMar be successful. Whether fighting for better access to health care for everyone, adequate housing conditions for migrant farm workers, or tuition assistance for undocumented children. Looking back at my career, my School of Public Health education played an important role in what I've been able to accomplish at SeaMar. This training helped shape my social views and priorities into concepts that helped me become a strong communicator with leaders and legislators. It taught me to be a good community organizer and to be an advocate for social change. It also gave me a foundation of knowledge that allowed me to be more confident, more courageous, and more effective. It contributed to my sense of leadership and ability to articulate my opinions and theories in a way that can affect change. As you prepare to go out into the world for the next phase of your life, I want to speak to you about how you can make a difference as a leader. As a graduate with a public health degree, you have bestowed upon yourself a new responsibility. Because you are equipped with a first-class education, you have become a leader by virtue of your educational achievement. It's up to you to decide what to do with it. We live in a world where human beings need to depend on one another to live in harmony as a community. Our country, or for that matter, the world, cannot survive if each one of us only thinks of ourselves. An effective leader needs to be concerned about the common good. As such, I encourage you to embrace these leadership responsibilities and prepare yourself for a lifetime of social justice. In this country, there are individuals who cannot make it on their own without the help of others. I'm talking about the poor, homeless, farm workers, or those that are in the margin because their income cannot support their families. The question then becomes, how can you, as a leader, fulfill this responsibility? The answer is simple. In any career, you will have the ability to give back. Whether you work in public health or become a lawyer, a doctor, an architect, or any other field, you can help those less fortunate with volunteerism, philanthropy, advocacy, or pro bono work. Leadership is a topic that has been widely taught, and there is a vast amount of articles describing what makes a successful leader. Some of the most important characteristics and qualities of an effective leader include such things as being a visionary, having good communication skills, having commitment and confidence, having the ability to motivate others, being honest and having integrity, leading by example, and having courage. Effective leaders that practice and adhere to these qualities and characteristics stand a good chance of being successful. Of these traits, I believe courage is the key attribute that defines a leader. When discussing leadership, courage often does not get enough attention, and it is one of the hardest to fully embrace and execute. How many times have we been involved in situations where we disagree with a group, but we decide that it's easier to go along with a consensus instead of raising a question or presenting a different point of view? Other times, the issue may be more significant, but we're still unwilling to challenge and go against the norm because we are afraid there may be personal consequences. An effective leader needs to learn to do what is morally right, no matter what the consequences are. Of course, compromise may need to happen, but where social justice is concerned, courage is the key factor that allows us to challenge and take a stand. This is where real change happens. A few years ago, our organization was involved in trying to help the legislature solve the lack of farm worker housing. A legislator proposed a solution to create farm-based housing using a substandard building code that would allow farmers to put up 4 walls and a roof. These structures were not going to have floors, installations, or wallboard. As an organization, we decided to organize a campaign to defeat the bill. We were successful in getting the governor to veto the bill. This effort cost our organization to lose the support of several powerful legislators. We decided it was worth it because no one should live in housing that is worse than third world housing conditions. Today, many farm workers are living in stick-built housing because of this effort. As you move forward in your life, you're going to encounter similar decisions and situations. You are going to have the opportunity to stand up for social justice when others are afraid to speak up. My advice to you is to have the courage to do what is morally right. By doing so, you will be a leader who truly impacts change for the universal good. I hope your education at the School of Public Health has been as rewarding as it has been for me. I wish your new journey will be as fulfilling and as fascinating as the one I've had the last 40 years. Even with the changes and improvements that have occurred in the past decades, from the vast amount of work done by public health workers and others, there continues to be challenges with healthcare disparities and social justice issues for many individuals in our community. This important work is not done. You can play an important role as a public health professional. Society is counting on you to help. I know that you can meet this challenge by working with other advocates and aspiring to make a difference for people in need. It will not be easy work, but I can assure you it will make an impact and it will be very rewarding. Once again, congratulations to the new graduates and their families. Good luck. Happy Father's Day to all the fathers that are in the audience. Thank you very much.